This is based off of 3 parameters: the number of cytopenias, the percentage of blasts, as well as the type of chromosomal aberrations. Those 3 parameters go into a scoring system that helps divide patients into 4 categories: low risk, intermediate 1, intermediate 2, or high risk. That particular prognostic scoring system has been revised and improved by incorporating additional cytogenetic abnormalities and putting specific parameters on the types of cytopenias like hemoglobin and platelet count and neutrophil count. Hypomethylating agents azacitidine and decitabine are FDA approved for patients with high-risk MDS and are really the core therapies that are offered to patients with high-risk MDS. So we often look to those therapies to help our patients and treat our patients so that their disease is decreased with regard to transformation to leukemia. And in the context of azacitidine, it increases their overall survival. Treatment response for many of our patients means that their cytopenias improve, so they have improvement in their white blood cell function, they have improvement in their platelet function and number, and they also can become transfusion independent. And for many of those patients, that is very meaningful. Many of our patients actually have improvement of their quality of life, improvement in their physical function, a decrease in their symptoms of fatigue, and those are also very important to mention. In terms of patients that have either previously responded to those therapies or then subsequently fail those therapies, it means that they lose those responses. Their counts decline, they have increasing transfusion requirements, or their disease progresses to a more aggressive type of cancer like acute myeloid leukemia. For our patients with high-risk MDS, we typically refer them for transplant when we first hear about them, only because that transplant process, just getting the information around what kind of transplant is possible for patients is really can take some time. And so we want to get started on that pretty much right away. We know that in high-risk MDS patients, they benefit from going to transplant. The logistics behind that and whether or not they are good candidates for transplant really need to be evaluated as soon as possible.